This slide series is done in memory of Dr. Edward Ross Ritvo, who passed away in June of 2020 at the age of 90 years. A pioneer in autism research, he led the field in establishing that autism was neurobiologically based. A graduate of Harvard and a U.S. Army veteran, he spent his entire academic professional career at UCLA. His work included studies of diagnosis and classification, genetics and epidemiology, as well as neurobiology and psychopharmacology. He trained generations of leaders in the field and is survived by family members and many, many students. It's an honor to dedicate this series of talks to his memory with the support of Dr. Ariella Riva Ritvo Slifka and the Alan B. Slifka Foundation.
Hello, and welcome to the Center of Excellence on Autism Spectrum Disorders at Southern Connecticut State University's Professional Video Series. We are Dr. Kimberly Bean and Dr. Kari Sassu. We are both members of the center team and also professors here at Southern Connecticut State University. We also have a great deal of experience working with students with autism spectrum disorders. And we're here today to talk to you about collaboration. Our main objectives in this presentation are to first identify team members' roles and responsibilities working with students with autism spectrum disorders in schools. And then we're going to identify strategies for collaboration in schools, and these strategies can be used at both primary and secondary levels. Before we get started on the formal presentation, I first want to define the term collaboration. From the dictionary, it's the state of having shared interests or efforts. It's the work and activity of a number of persons who individually contribute toward the efficiency of the whole. So thinking about this definition in the context of schools, the shared interest or efforts is the student and how the number of persons working together contribute to the efficiency of the whole program for the success of that student. In schools, we can think of collaboration in terms of collaborative teaming. Collaborative teaming is a dynamic process in which teachers, parents, related service providers, and other individuals working with the child come together to troubleshoot problems a child may be experiencing in his or her educational program. And there are many teachers and related service providers working with the parent and involved in the education of a student with autism. Students with autism spectrum disorders often receive multiple services from various educational personnel, including those listed here. They may be receiving some or the majority of their programming in the general education classroom, and they may be receiving specialized instruction by the special education teacher. They will also require services in the area of social skills, and these may come from a school psychologist, counselor, or a school social worker. They may be receiving speech and language services to help support communication needs. And students with ASD may exhibit fine and gross motor challenges and will require support from occupational and/or physical therapists. Additional behavior support may be required from a certified behaviorist, and a paraprofessional may provide support or academics in both the classroom and other settings in the school. In the collaborative teaming process, we need input from all of the educational personnel in order to fully understand the student's strengths and weaknesses. As discussed, students with autism spectrum disorders often receive multiple services from various service providers, including those represented on the previous slide. Each of these service providers have skill training in their unique discipline. The skill training contributes to their own outlook and perspective of the child and effective programming. These perspectives may lead to challenges in planning, but the hope is that together, team members can all understand that all of these perspectives complement each other, not conflict. But to fully understand all the strengths and weaknesses of the student, we also need to include the parent. It's really important that we have the input from parents. This is a requirement of our federal law that protects our students with disabilities and their families, and therefore that input from parents must be considered. We need to bring together all these educational personnel and the parents to one table to best understand the strengths and weaknesses of the student with autism and then the team can develop a comprehensive program. It's imperative to remember that all of these educational personnel and parents have a different area of expertise because not one person is skilled in all of these different areas. With every team member's explicit experience and knowledge in their discipline, they have their own unique perspective. In order to create an effective program for our students, we need to hear and understand each unique perspective of the team members. By doing this, we can start to establish some shared expectations. We can do this by identifying roles and responsibilities of each team member, establishing guidelines for communication, and working together to set appropriate goals for the student. Let's now talk about ways we can involve the parents. There are many factors that impact a parent's perspective, but we really must understand that the parent is the expert of the child. If we have that concept in the forefront of our minds, then we will begin to start this process of understanding. It's been documented in the research that parents of children with disabilities have increased levels of stress as compared to those parents of children without disabilities. And parents of individuals with autism have even higher levels of stress. And this may be impacted by the severity of symptoms associated with autism, including those behavioral and social communication challenges, the dynamic of the family, if it's a single parent or if there are multiple children with disabilities in the home. And then there's the financial burden of raising a child with autism. There may be increased expenses for out of the home therapies or support in the home, or additional medical expenses associated with autism. Everyone needs to realize that a strong parent teacher relationship can help reduce the parental stress in parents of children with ASD, and you play a role at shaping that relationship. We can't emphasize enough that the parents must be involved in the treatment process of their child and in educational settings, and that treatment involves the development of a comprehensive program. One way that we can gain parental input right from the start is developing a parent survey. The parent survey is an informal tool that can be created by the whole school team collaboratively. It is then given to the parents in order for the team to gain more insight as to what the parents' concerns are and the parents' view of the child, as well as additional parent needs. When you are creating a parent survey, it's important to consider the following. You need to make sure the survey is not written in too much educational jargon or terminology. Make sure it's written in vocabulary that parents can understand. Also, you need to make sure it's written in their language that they're more comfortable reading in. For instance, for families who speak Spanish, you may want to send the survey home in Spanish rather than English, or maybe provide both options for them to choose from. You also want to make sure that we give our parents enough time to complete the survey. So it's not something that you would send home on a Monday and expect back on a Tuesday. You can send it home on a Monday and write clear directions that they can return it later in the week. You could also provide the survey in digital and paper copy. The use of Google Forms or Microsoft Forms would be an easy way to create an electronic form of the survey to send out through email. You can also send a paper copy too and provide the parents with the option. And when creating the survey, try to make it easy for them to complete by using a checklist. It's a nice way for the parents to check off what they feel they may need. But don't forget to provide an option to fill in their own needs that may not be listed there. The survey should start with clear directions of what the parents will need to do and remind them of the timeline for completing the survey. You should also include information about preference of communication. For instance, do parents prefer you to contact them through email or phone calls? And when would they want these phone calls to be received? Then the survey can go into the needs of the parents. What needs might they need? Resources, support groups, or access to community services? Then you can talk about the parents' views of their child, specifically their interests, what the child likes, what they don't like. You can ask about specific strengths and concerns that the parent has for the child. And then the next section can include goals. So, what goals would the parent have for their child? And they can be goals in academic, social, communication, or even family goals within the home. After gaining more information from the parents, the school personnel can gain more insight on the parent perspective. Dr. Sassu will now discuss strategies for working with educational personnel and team members within the school setting.
When we come together as a transdisciplinary team, there should be a recognition and an appreciation for the myriad skills that are brought to the table. Whether you're a special education teacher, a paraprofessional, a speech-language pathologist, a behavior analyst, or a school psychologist, the understandings and the strategies that you have all help to develop a dimensional picture and understanding of the child. The transdisciplinary model is one that allows us to not only present our understanding of the child's needs, but also to gain additional perspective from those others around the table who see the child through different lenses. The complementarity of these perspectives is what we should be looking to capitalize on as we seek to enhance our understanding and develop strategic solutions to presenting challenges. Collectively, we're able to create well-informed, thoughtful plans that have the shared goal of advancing the student's skills. In establishing shared understandings, communication really is the keystone. In order for all members of the team to be headed together in the same direction toward established goals, we must ensure that we have clear and well-established expectations for communication. These should include expectations as they relate to the frequency and types of communication shared among and between members, as well as a set schedule for data collection and progress monitoring. At the outset, the team should develop a well-articulated plan that clearly spells out the specific information and data that will be collected, the frequency of the collection, and the parties responsible for progress monitoring and reporting. In addition, a tentative schedule for reporting and sharing information should be set. Communication should occur both during the larger collective meetings as well as at points between these group meetings. To ensure the team is adhering to the schedule for information and data gathering, as well as making timely changes to the plan as proves necessary. While each team member comes to the table with their own areas of expertise, it is important that team members respect each other's perspectives, even when they differ. And beyond respecting these differences, that they actively work to develop an understanding of others' perspectives. Different perspectives should not necessarily be seen as opposing perspectives, but ones that are meaningfully informed by training that explores the same presenting issue from different angles. If the shared goal is to advance the skills of students, it is important that team members not only put differences aside, but that they actively work to cultivate relationships with other team members, including the parents and caregivers. This is likely to result in greater levels of investment of all parties, and ultimately yield better outcomes for the students served. One of the best ways to ensure that shared goals and expectations are not only set, but that common understandings result from such, is for there to be a designated point person who actively works to build understanding among team members, including parents. This might be a case manager or another team member who devotes the time and energy required to recruit information from members of the team, seek clarification when needed, listens to concerns of members and validates those concerns, as well as shares that which is relevant and necessary. This person serves as the nucleus of the team, ensuring that all relevant data are collected, maintained, and shared with those monitoring change and making decisions, along with any questions or concerns that might alter the course of the team's established plan. This person seeks input and disseminates information, also actively listens, asks probing questions, validates, and strategizes. When communication among team members only occurs during formal meetings or sporadically in between, we often see plans deteriorate or ineffective strategies prolonged. So it is important that the team keep the feedback loop tight, meaning communications are frequent and purposeful. Data used to inform the process and members are brought back into conversations so that changes can be made if it is determined to be appropriate. For illustrative purposes, this case study has been included such that we can pull out elements of the collaborative teaming effort. Frederico is a 7-year-old student with ASD in 2nd grade. At the beginning of the school year, his behaviors seemed under control. However, around the 6-week period, Frederico began eloping from the classroom, walking around the classroom, and not completing his daily work. Frederico's parents reported in the parent survey given at the beginning of the year that Frederico often runs from the house. The general education teacher was highly concerned about Frederico's safety, his learning, and the disruption the behavior was causing the rest of the class. His annual review was not scheduled until January. However, the special education teacher and general education teacher felt that the team should meet in October to develop a plan to support Frederico. Resulting from the engagement of collaborative teaming, as was described throughout this presentation, the team members did not wait to present these concerns at the annual review, but instead met to share their concerns and devise a plan. The established plan would explore Frederico's behaviors through their respective lenses, collecting information through interviews, observations, and assessments. Once a plan was established that included which team members would undertake various parts of the process, they collectively undertook the process. The case manager communicated regularly with the parents as well as other school-based team members in between his initial meeting and the subsequent meeting that was scheduled for approximately 4 to 6 weeks later. At that meeting, the team reviewed all of the data that had been collected, and the information was exchanged among all members of the team throughout. While some challenges remained, there were no surprises in that which was presented due to the communication being clear and frequent in between these meetings. Following a review of the information and data collected, the team jointly decided on strategies that would be employed both at home and at school, and spelled out the next stage of the plan. Through this method, the team decided on the following strategies and established a plan for moving forward. The selected strategies include posting a visual stop sign on the classroom door to signal all students to stop, parents posting a visual stop sign on their door at home. A visual activity schedule was provided that outlined tasks to be completed, and transitions were structured using a visual schedule. Teachers further provided verbal praise when Frederico was working in his seat by stating something like, "I like how you're working in your seat. You're almost done." Data was collected by team members over the next 4 weeks. A team meeting was set for 4 weeks later to review Frederico's progress once again with these new strategies in place. At the next meeting, not only were these data reviewed and used to inform decision-making, but all members were provided opportunities to share any current concerns. The team once again integrated the information into the plan and revised the plan such that Frederico could continue to build on the new strategies that he had developed. Moving forward, team members would continue to communicate frequently and purposefully to best serve Frederico's needs. Most importantly, Frederico's team learned that through frequent communication, regular data collection, reflection on their practices, and the revision of strategies informed by those data collected, that they were in a better position to do the work necessary. Not only was each member of the team better positioned to work with Frederico, but also with other members of the team, including the parents. Together, the team was able to establish new goals for Frederico that were well-informed, employed the skills of various team members, and supported Frederico to reach those goals. The benefits of collaborative teaming include maintaining the focus on the child with an increased understanding of the ways by which team member skills and training serve to complement one another in reaching shared goals. Through collaborative teaming, team members are brought out of practicing their professional skills in isolation, instead learning from one another and teaching others about their professional approaches. The complementarity of this ultimately results in better informed strategies that result in improved outcomes for the student. With increased understanding among team members, not only are the professional perspectives enhanced, but buy-in for the established plan is also increased. And this collective investment results in overall improved outcomes for the student, which is our ultimate purpose and most important goal. Thank you for watching this video. We hope that you gained some valuable information about collaborative teaming from this presentation. For more information, please visit our center website listed here.